Hi, welcome. I'm Elise Washington, a project manager supporting Missouri Healthy Schools. Missouri Healthy Schools provide students with lifelong advantages built upon early positive health behaviors that improve conditions for academic achievement. Check out mohealthyschools.com for more information about our programs and upcoming events. Today, we're really excited to have Dr. Katherine Park with us. Dr. Park is currently serving as the Interim Director for Health Services in Parkway School District in St. Louis. She's been involved with school health in Missouri for nearly 20 years, most of this time serving as a school nurse in a variety of settings. She's done numerous presentations and been involved in a variety of projects centering on type 1 diabetes management in the school setting, and has made diabetes a focus during her work in both her master's and doctorate in nursing degrees. Welcome, Dr. Park. We're excited to have you.
Thank you so much. It's great to be here. Okay, we are going to go ahead and get started. I'm so excited to have this opportunity to talk once again about Missouri's House Bill 675, Cade's Law. This came up a number of years ago, so we are here talking today to talk about some of the updates and also just basically reminding everyone about what that is and how schools can work with that and apply that in their own setting. Missouri House Bill 675, also known as Cade's Law, was initiated in January of 2014 by the Department of Elementary and Secondary Education. And it stated that schools, if they chose to abide by this, should develop certain guidelines for the training of school employees in the care needed for students with diabetes. Schools were given the freedom to decide whether or not they would adopt these. But if they chose to, then there were some guidelines and guidance that came along with that, just to give people a direction on where to go when initiating diabetes management in their school setting. Topics to be covered, the main ones today for Cade's Law are the recognition and treatment of hypoglycemia and hyperglycemia, understanding the physician instructions concerning insulin and basic pump functions, the administration of glucagon in an emergency, recognizing complications that might mean an emergency has arisen, and also understanding how blood glucose and food intake can be impacted by physical activity and schedule changes throughout the student's day. It's important to note here when we talk about doing training in schools for unlicensed or non-medical school staff to know that also included with Cade's Law under section 167.821 is that no one will be held liable for civil damages if they are operating in a manner in which they were trained and the duties that they were trained to perform. So that's why it's extremely important to make sure any training that is done is documented and that's revisited often. And we will talk about that today as we go along. Before we really get started, here are some wonderful resources to have and make sure to consult with when thinking about setting up diabetes training. Janice Seligman's School Nursing, a Comprehensive Text, has a wonderful chapter 25, Students with Diabetes, that will answer many, many questions many people might have. Also, Helping the Student with Diabetes Succeed. This has been a reference that's been around for many, many years. The latest update occurred in 2016. That is now accessible completely online. Used to be a hard copy that you had to send away for, but that is now completely online. And that is put out by NDEP, National Diabetes Education Program. Also, Colorado Kids with Diabetes, coloradokidswithdiabetes.org. Check out that website. That will answer many questions as well about diabetes care in the school setting. So it's a wonderful resource. And finally, also the American Diabetes Association. Their program is largely what we have based our training tools on today. So many of our slides and information were originally taken up from the American Diabetes Association. And so they've been a great, great resource to use And over the years, they've also been updating their resources online as things do change with diabetes. And as equipment changes occurred, all kinds of different things, they've been very well updated with their guidance. So it's just some wonderful resources to refer back to. First of all, before we really get started into talking about training staff and diabetes management in schools, what does effective diabetes management look like? These three main guiding pillars, if you will, come from the Helping the Students with Diabetes Succeed guide from NDEP. And these three tenets of care include maintaining optimal or normal range glucose, assisting the student with performing diabetes care tasks when it is warranted and needed, and then designating trained diabetes personnel in our schools. And this is in addition to a school nurse, which ideally will also be well placed and well positioned to lead this up in the school setting. But irregardless of the presence of a school nurse, it's still important to have at least a few additional trained staff as well. So we'll also talk about that as we go along. Training staff, all the who, what, why, how, and when's type of questions you might have when you first think about that. Based out of, again, NDEP's guidance on helping students with diabetes succeed in the school setting, they recommend 3 levels of training, and this has been widely adopted nationwide in many diabetes management programs in schools. The first level, level 1, is for everyone in a school building. So if you think about everyone associated on a daily basis in a school building, this could be school secretaries, it could be custodian, recess monitors, certainly teachers. Every person who is on staff and in a school building should have some basic knowledge of diabetes basic information and just basics about what it means with signs and symptoms. Also, how to recognize when something might be an emergency or might be approaching an emergency. Training in level 1 can be done in a variety of ways. It might be done in person at an all-staff meeting at the beginning of a school year. It could be done by handing out handouts in staff mailboxes, just some basic information on this is what diabetes is, this is what you should look out for, these are the signs and symptoms of a problem. It can be done through electronic communications, such as emails, just shooting out an e-blast to all staff with some basics and basic information and signs and symptoms about any concerning emergency type situations. It's really important to note here that though level 1 education is basic, it should be revisited more than once during the school year. Ideally, halfway through a school year is a good time to send out another informational handout, a follow-up email, perhaps reminding staff at a follow-up staff meeting in person, just a reminder about the diabetes basics. The importance of level 1 education cannot be overemphasized, as a student with diabetes experiencing a problem can just as easily encounter the copy room secretary as they can their own teacher at any given point in time. Therefore, having all adults in a building at least knowledgeable on recognizing a diabetic crisis can help ensure the safety of the student while at school. So level 2 training is for school personnel who have a daily responsibility for the student with diabetes. And this still might include many people. It wouldn't necessarily include the custodian who is in the building every day, but doesn't come in close contact with this particular student. But it would include certainly the classroom teacher, special teachers like physical education, art, music teachers, recess staff, lunchroom staff, bus drivers, Staff should be informed on all the level 1 training that we just discussed, plus also more specifics on how to respond in an emergency. So not only should staff recognize an emergency, they should know how and what the procedure might be and what to do to respond to an emergency. So it's not enough to just recognize, oh, this might be an emergency. Knowing what to do and take that next step is primarily the duty of anyone trained at the level 2 training. This should be done in person, either as a small group or a one-on-one meeting, so the school nurse or the trainer can answer any additional questions, demonstrate any equipment that the student will be using so that the staff is at least familiar with some of it, and provide specific information on each individual student needs. The staff at this training level do need to know who the student is. So providing a school photo if needed, or whatever the school procedure is in a particular building is really important, because we're asking staff to keep an eye out and be trained on some basics about this student with diabetes. So at minimum, they do need to know who this student is. Also, what the student's daily schedule might look like, how to accommodate the student's health needs, and where emergency snacks might be located throughout the building. So similar training to level 1, but a few additions are added at level 2. And then level 3 training says best practices for diabetes management. In many multiple sources all agree that there should be more than one person in a building familiar with diabetes and knowledgeable enough to assist with and take over in an emergency if they are needed. Historically, school nurses were the only people knowledgeable on diabetes in a school setting. However, not all schools throughout our nation or throughout our state do have full-time nurses on staff. And even when there is one, there is no guarantee that that nurse will be available at the exact moment and at the exact location when a student with diabetes needs assistance, or that a substitute nurse will be available when the nurse is out. Therefore, having additional people trained in a building on how to help with diabetes care tasks, basic and emergency type tasks, is essential to keeping the students safe at school. Ideally, there should be 1 to 3 trained people in a building with a student with diabetes at this level. And the trained staff members at this level are designated as trained diabetes personnel, or TDP. Trained diabetes personnel may include staff secretaries, a teacher, a principal, a health aide, LPN nurses, or many others. They should be informed on all the information from levels 1 and 2, in addition to being trained on how to assist with the student's particular and unique equipment that they may have with them, and also the care of that equipment. It is recommended that trainers utilize hands-on equipment when training that corresponds to different components of diabetes care. This may include glucagon trainers, practice syringes, glucose meters. We'll have examples of this as we go along. Training at this level does involve delegation of nursing tasks to unlicensed personnel. So step-by-step instructions, clear parameters, documentation of the training, and ongoing evaluation by the school nurse is very important. For specific guidance on how to put together a toolkit of supplies and how to train staff, please check out our information on the Missouri Department of Health website. And we have the link here listed on this slide as well. It's with the Missouri Department of Health and under school health. You'll be able to find a whole wealth of resources associated with training. These are some components or additional components of level 3 training. It's important to make sure that you do have approval and gain support for performing this type of training in a school setting, whether that's the principal, making sure they're on board, as well as perhaps a superintendent in the school district, and just making sure that everyone is aware of the need and the importance of this type of training. Also soliciting volunteers. We never want to assign or appoint someone to be trained on diabetes care tasks at this level. It does need to be someone who willingly volunteers. Again, obtaining training equipment so staff that are trained have an opportunity to practice with hands-on tasks is very important as well. Conducting the training and setting that up, what that looks like, making a program for training and facilitating that, whether during the school day or after school hours. Providing the volunteers with information that they can keep with them. Sometimes even just having basic information in a binder and telephone numbers of people to contact if they are faced with a situation for the first time and they're a little uncomfortable with what to do next. Having that support system in place in advance, or at least a place where they can go to look for information, is very important. Certainly documenting the training and revisiting that periodically, at least if not annually. It's also very important. Providing information for the buildings, being able to post a sign either in the nurse's office, the health room, or the main office that states the following people in this building are trained on diabetes management care tasks per the American Diabetes Association is important for not only parents to see, but also any other visitors that come into the building. So it's just a nice thing for, like I said, parents to see and be aware of, and then it also lends credibility to the training that the staff have undertaken in that building. And then also periodic reviewing and refresher trainings, skills practice whenever needed. That will be determined on a case-by-case basis. So we've been talking about diabetes now for a short while. Let's go into some real basics about what would be included in a training program for trained diabetes personnel staff. In a nutshell, in diabetes, the body does not make or properly use insulin. Insulin is very, very important because it helps move glucose from the blood into cells for energy. Every time a person eats food, a byproduct that occurs as the food is being broken down in the digestive system is glucose. Glucose is very important for a number of things, and it will circulate within the body and throughout the body and provide energy when needed. However, we don't like to see that glucose continuously circulating in the body, because when it does, that can cause some eventual short-term problems and long-term problems. Insulin is released normally through the pancreas, and it is used to help move that excess unneeded glucose out of the bloodstream and into cells where it can be safely stored away for future use. If a person does not have insulin being made in their body from their pancreas, then many problems will start to arise. And we've listed just a few of these here, but eventually extremely high blood glucose levels that are continuously circulating throughout the body will start to cause damage and can make the person very ill. There are many, many discussions and terms and terminology about diabetes that can get overly complicated, but again, just keeping it real basic and simple, this in a nutshell is what diabetes is all about. Primarily, we're here today talking about type 1 diabetes. Type 1 is differentiated from type 2 in the fact that type 1 cannot be prevented. It's an autoimmune disorder. It occurs when the pancreas does not produce insulin. It either did produce insulin for a while and it shut down, or a person might be born not producing insulin. Because we already talked about how insulin is very important to maintaining glucose levels in the body, just because a pancreas is not producing insulin doesn't mean that person doesn't need it anymore. This person will require multiple doses of insulin every day, multiple times a day for the rest of his or her life, unless or until a cure is found for type 1 diabetes. Just by contrast, type 2 diabetes occurs when the pancreas either does not produce quite enough insulin, or it is producing insulin, but for multiple reasons, the body is not using the insulin properly. We're seeing an increase in type 2 diagnoses among children and adolescents in the United States. And largely this is being attributed to more inactivity, poor diets. Type 2 diabetes can possibly be prevented or even sustained or reversed through lifestyle changes, including diet modification and exercise. So this again is not what we will be focusing on here, but it is just here to contrast between type 1 and type 2. So our number one goal with type 1 diabetes management is to maintain a target blood glucose level. Maintaining a normal level in a person's body most of the time. And we'll talk about what normal looks like, what that means specifically. This is an ideal depiction in just one slide, basically about diabetes management. It's a constant juggling and balancing act, 24 hours a day, 7 days a week. Many things will affect blood glucose levels. Things like insulin, extra physical activity, extreme temperature changes, weather, hot weather, very cold weather, being stressed, taking medication, all of those things can affect blood glucose levels in the body, causing glucose levels to drop. Certainly food is one of the things that can cause the glucose levels to rise. So it does become a constant balancing act to try and get to that normal target blood glucose range. And I like to often point out here that you can have the most well-managed student and the most involved parents and the most involved doctor and the best, highest tech equipment helping a student manage their diabetes. And that is still no guarantee that there won't someday on any given moment in time be a sudden drop or change in their glucose levels. So certainly having a plan in place and having management procedures in place help, but none of those are guarantees that will prevent totally a sudden drop or sudden rise in blood glucose levels. So with diabetes management, we think about two types of care: routine care, based on the age of the student and the diagnosis, how new that is. Many students may need help with all of their care tasks throughout the day. Some students may need minimal help. Eventually, most students are able to handle most or all of their routine daily diabetes care tasks by themselves. Sometimes though, however, you will have an older student, perhaps in high school, that has a new diagnosis that might need help with all of those daily care tasks at first. Also, sometimes we will see students with special needs who will continue to need extensive adult help while at school with their diabetes. And in an emergency, any person with diabetes might need assistance. And I say person here, not just student, because sometimes we do have staff members in school buildings that also are managing type 1 or type 2 diabetes. So in an emergency situation with a very low blood glucose level, any person might need assistance. We have been talking already about glucose levels and high and low Here are our official terms for both of those conditions. Hypo is low. This is the situation we're most concerned about in the school management of diabetes. This can happen suddenly. And a common question is often, well, how sudden is suddenly? Does that mean seconds? Does that mean over a couple hours, couple days? How fast does that actually mean? And the best answer to that would be certainly within a few minutes of time. A person with a borderline or even normal range glucose level could suddenly start to experience a drop. And so within the course of several minutes of time, a low blood sugar might start to develop. This again is the thing that we look for the most, the one we're most concerned about, and the one that can turn into an emergency situation very quickly. By contrast, the high glucose or hyperglycemia usually happens gradually, often throughout the course of many hours, if not days, sometimes slowly over a week or two. The blood sugar will be slowly rising. So important to monitor, of course, but not the sudden emergency type situation that we worry about with the low blood sugar levels. Hypoglycemia. Here are some causes of what might occur with a low blood sugar and what might cause it. A combination of any of these factors, in addition to many more that we can't list here, could cause the blood sugar to drop for sometimes unknown reasons. So these are just a few of the known reasons that will affect blood glucose levels. Many times, staff are trained or information is passed out that involves charts and cartoon pictures of symptoms, perhaps arrows like this one you see here. I like to put these in here mainly to point out that anyone who is involved in training someone on diabetes, anyone who has received education and training on diabetes, should never get too bogged down on charts. And I say this because there are many symptoms that might indicate a problem. And in a few slides, we'll see an arrow going up in the opposite direction for hyperglycemia. And if you were to put the two arrows side by side, you might notice that some of the symptoms are the same. You might feel anxious with low or high blood sugar. So it would be important for everyone to realize that if it's a person that has diabetes or is known to have diabetes or is exhibiting symptoms of a blood sugar issue, assume it might be low and treat accordingly. If in doubt, I wouldn't want anyone to ever get too bogged down on trying to look at different charts and figure out, well, they're hungry and pale, but they're also confused and shaky. And so, you know, that might waste precious moments of time trying to figure out which it is. If you're not sure, assume it might be low. When we assume or we know that a person is experiencing a low blood sugar, we look for that sudden change. So this, again, is a reason to not get too mired down in all the different possible symptoms to look for. More important is to look for that sudden change in the person. They may have been engaged in a conversation just a minute ago, and the next time the teacher looks at the student, they're suddenly sweating and their head is down on their desk for no particular reason. This won't always happen during physical activity or during PE. They could just be sitting in class, engaged in classroom activities, and suddenly they're not feeling good. Something seems to be off or wrong. So look for that change. That will be the biggest clue that the person might be experiencing a low blood sugar level. For these, we respond quickly by giving a 15-gram carbohydrate type snack. There's a few examples listed here. We have some more examples on our next slide as well. Waiting 10 to 15 minutes, either checking the blood glucose level or having the person just report, yes, I feel much better, and they're visibly better. And if not, then going forward and treating again with another 15-gram carbohydrate snack. These are some additional examples of snacks. What we don't want to do for someone experiencing a drop or a low blood sugar is to have them drink half a gallon of orange juice, a couple candy bars all at once. Because what will that do? That will cause that low blood sugar to go way up here. Now we have high blood sugar. We may have mitigated the issue or the emergency situation, but now we've caused and created a new situation because we have high blood sugar. Again, not an emergency, but we're not staying in that normal target range. So that's why we try and just gently nudge things up slowly and deliberately with small amounts of food. If we get to the point where a person cannot eat a snack, they are either unable to follow directions, unable to swallow, or they've passed out and now they're unconscious and they can't eat, this is a medical emergency, because now our number one way to treat their low blood sugar is not possible to be done. In this situation, we will be administering the Glucagon emergency medication, and we are also calling 911. Hyperglycemia. We mentioned this again a few moments ago. Some causes of a high blood sugar are listed here. You'll notice, just like with the low blood sugar, there could be many reasons for either high or low blood sugar. Many things can affect the blood sugar levels in a body. Here is that up arrow again, just once again pointing out that the symptoms may be similar for both low and high, so do not get too bogged down in trying to figure out with charts what might be going on with the person. If they have diabetes and they suddenly don't feel well, something suddenly isn't right, assume it's low. In treating hyperglycemia, these are just some of the real basic steps that are often taken. Again, not a 911 type situation, but these are some things that will be indicated in the doctor orders or the diabetes medical management plan, which is a very extensive form signed by a doctor that outlines care for a student with diabetes. Glucose monitoring. We've been talking now a lot about glucose levels and target range levels in the body. Checking the blood glucose levels is something that is typically done anywhere between 1 and 3 times during the school day, and can occur even more frequently if the situation calls for it, or if the student is on a continuous monitor. There are currently 2 main ways to check a person's blood glucose level. On the left side of the screen, you'll see an example of a typical and traditional blood glucose monitor. These monitors all basically work the same in that a test strip is inserted one end of the monitor. The person uses a little tiny needle lancet to obtain a tiny drop of blood, and that drop of blood is touched onto the strip. Then we wait, and a number is shown telling us what the glucose reading is in that moment in time. This number is what is used to determine whether the person's blood glucose is high or low, and it's also used in conjunction with determining an insulin dose before a meal. When we talk about target glucose ranges, what is normal, that is something that will be indicated on the medical orders from the doctor. Generally speaking, if you just remember one number around 100, that would be a normal glucose level for anyone, even people without diabetes. Ranges typically sound something like 80 to 120 is this person's normal range, or it could be 70 to 140. Generally, though, if you remember 100, that's in the middle of anyone's normal target range. Another device used to monitor and check blood glucose levels, though, this has been growing in popularity, and this is the continuous glucose monitor, or the CGM. This use in schools has quadrupled in the past several years, so we see a lot of these in our schools. A sensor is worn by the person. That's the picture right there in the middle. This sensor is typically applied at home and changed every several days at home. The sensor sends blood glucose readings every few minutes to a monitor or a smart device like an iPhone or an iPad. You can see here on this monitor that not only does it show a number, it also shows a graph of the continuous readings so that the trends can be visible instantly. If you can see right next to the number 168, you'll see an arrow pointing to the right. We'll talk about that next. Here are some additional information on CGMs and how the arrow acts as a quick visual aid for interpreting the trend of these continuous individual blood glucose readings. In our previous example, the arrow pointed directly to the right, indicating that the trend for this person's glucose has been constant. So you can see the arrow here on this screen. The one pointing straight to the right means constant. Different arrow symbols shown here interpret the trends of the blood glucose levels in near real time. And I say near real because there is a lag of a few minutes with CGM readings. Because the use of CGMs in schools is still relatively new, make sure to check with your district to see what, if any, policy is in place regarding the use by students with diabetes. School nurses are not obligated to provide one-to-one monitoring of this device, nor to use their own personal smart devices in order to receive the data. Read more about CGMs and guidelines for their use in schools from the American Diabetes Association and from the website coloradokidswithdiabetes.org. With blood glucose monitoring, the American Diabetes Association recommends, and most organizations also adapt the approach that a student, a person with diabetes should be able to check and perform daily care tasks anytime, anywhere, any place they need to. This is safest for the student to be able to do that on site and not have to travel to a different part of the building or to the nurse's office, even in some cases, especially when they may be feeling low. It allows them to gain independence. It allows them to be able to miss less class time. Certainly, this will be dependent on the age and the skill level of the student, but that is something that can be worked with school nurses and trained staff in school buildings to set up a good plan of care and to allow independence as the student is able to achieve different levels of that with their own personal management. That's really the best way for students to maintain good control and to stay safe at school. So we've been talking about checking blood glucose levels. When do you check? How often do you need to check? Routine monitoring generally occurs anytime right before a person eats either a meal or a large snack. Sometimes it might be appropriate to check blood glucose levels before engaging in PE or strenuous activity, sometimes after that type of activity. Glucose levels should be checked, monitored anytime someone is experiencing symptoms. And so also anytime there are any issues leading up to periods of illness, stress, right before important tests. So in other words, there could be any number of situations where blood glucose should be checked. or in the case of the CGM, should be viewed and monitored for the trend, what's been going on lately. Typically during the school day, a student will check 2 to 3 times, would be most typical, certainly at lunchtime. Sometimes for students that eat breakfast at school, that may be a second time or the first time. And then depending on what the student is doing on any given day, sometimes it may be appropriate to check in the afternoon or right before they're dismissed. So typically it will be anywhere from 1 to 3 times during the school day. Insulin. We talked at the beginning about the importance of insulin. They're the main insulin delivery systems that you will encounter in schools. Vials and insulin syringes and vials of insulin have made a recent comeback in the past few years. This is primarily the least expensive way to administer insulin. So sometimes due to insurance costs, this may be what the student has that they need to use at school. Insulin pens, which you will see there on the left side of your screen. Insulin pens have become the most common system used in schools. These have a snap-in cartridge of insulin and disposable screw-on needle tips. The amount of insulin is dialed into the end of the pen, but can be only delivered in dispensed in whole or half units. Insulin pumps are also more and more popular, becoming more and more popular in schools, especially with older students. Sometimes we do see these on students as young as preschool, however. A common misconception with pumps is that they take care of all the insulin needs on their own. But the fact is that they still need human interaction and input in order to deliver insulin doses. Another misconception is that there are needles where the pump attaches into the skin, but the needle is only used to insert a very tiny catheter, and then that needle is withdrawn. So you can see on the far right picture, the catheter is inserted into the person's body, and then they wear that, that's taped on, they wear that pump with them most of the day. Pump pod placement is something that's usually done at home by the parent and or the student. It typically isn't something that is done at school. And it is a good idea to have backup supplies like syringes on hand for any failures with the pump, in which case you can take that cartridge out of the pump itself and then use a syringe to draw out and then administer insulin for the person. These are some common sites that insulin can be delivered. And it's always a good idea to rotate those sites around. Back to more specifically the insulin pump for just a minute. Again, this is a very small device about the size of a pager, just a very small flip phone, cell phone. It is worn on the body by the person. The insulin is in a snap-in cartridge in the pump. And even though there are small amounts of insulin that are administered throughout the day, again, the pump will need human interaction to input carbohydrate counts and different things like that before or when a person eats any meal. And this is just a really good picture here of the insertion of the insulin pump catheter and what that looks like, kind of close up. The pump brand Tandem Tee has a free app that can be downloaded to any smart device so that users can see and practice with giving insulin, programming in carb counts, and a whole lot more. This is the only one out there that is available at the moment that is a free app that can be used by anyone. I've downloaded this app myself just to practice with it. Even if your student that you are giving care to uses a different brand of insulin pump, This app is still worthwhile to check out since most pumps operate in very similar ways to this one. Glucagon. We did talk about emergency type situations, and here you will see the currently 2 different versions of glucagon that are available right now. The one in the red case is an injectable glucagon product. It requires a 2-step process of mixing a solution into the syringe and then drawing everything back up before it's administered. The picture on the right shows our newest form of glucagon, and that's the Baqsimi. It's a dry nasal spray that's given in emergencies, and it's dispensed once into one nostril. So as you can imagine, much easier to utilize. Ketone testing. Ketones are acids that result when the body experiences extended high blood glucose, does not have enough insulin, and begins breaking down and using fats for energy. This may occur when insulin is not given, during illness, during extreme stress, dehydration. There could be many reasons that might cause high blood sugar to start breaking down and forming ketones. When the ketones build up in the blood, they can cause abdominal pain, nausea, and vomiting. The ketone test strip you see here in the center is used in a vial of urine after urine sample is collected, and then compared on a chart to see if there's no small, moderate, or large amounts of ketones detected. The doctor orders will specify what a person should do when ketones are detected. Less commonly used to check ketones is a monitor that tests a small drop of blood, very similar to the process of testing blood glucose. You'll notice that looks like the glucose monitor, but at the very top, ketone, the word ketone is in bold print at the top of this monitor, just to try and keep the track of the differences between the two if you're working with a student that has both. If ketones are detected, these are some basic treatment orders for managing ketones. These are just some of the most common ways that we keep an eye on ketones. Certainly the doctor orders might have something more specific. Again, though, a useful tool to help us determine what is happening with a person's blood sugar, but not something that would rise to the level of an emergency type situation. Nutrition. The most advanced carbohydrate counting method allows a student or a person to adjust his or her insulin depending on the amount of carbs eaten at each meal or snack. The insulin to carb ratio is something that a doctor will determine. It'll vary from person to person, so it won't be the same for everyone. It will be included in the DMNP or the doctor orders. And it'll be stated kind of as a math ratio of 1 unit of insulin to X grams of carbs. So we'll go to this next slide and just look at an example. If you have a doctor order written as give 1 unit of insulin per every X grams of carbs, and you eat, and the ratio is 1 to 10, you would need for a meal consisting of 60 grams of carbs, 6 units of insulin. So we're giving 1 unit for every 10 grams of carbs. That's a very basic ratio that is used, and that is what we refer to as the insulin to carb ratio. In talking about all these things that we are monitoring and documenting and keeping track of, just keep in mind it's always really important to maintain accurate records. Here's an example of one type of hard copy paper chart that can be used. Certainly many school systems and school nurses have electronic documentation programs where the information can also be input directly into the computer. But charts like these are also useful because they help give a real good bird's eye view, just kind of a picture at a glance of what's been going on, not just today, but perhaps over the last several days. So it's always a good idea to keep backup or double up on some of your record keeping. And this also helps the student too. It helps the student that's old enough to be able to document some of their own care with the nurse or person helping and assisting them and overseeing that to make sure they're calculating math ratios correctly, things like that. So really important to have good records being kept. And finally, as we wrap up here, we wanted to include a section on COVID-19 pandemic considerations for students. Whether a student has been or will continue to be a virtual learner or an in-person learner, this pandemic has brought to light a whole host of new issues to tackle when it comes to students with chronic health conditions, most specifically diabetes. When a person with diabetes is participating in virtual learning, they should always be permitted to take a break and leave their online classroom session to take care of any diabetes care tasks that they may need to perform, whether that is checking their blood sugar, whether that's leaving the computer to go get a snack quickly and then returning, being able to turn off that monitor for a few moments is really important. I know many teachers have rules for students saying they cannot do that, but in the case of a student with diabetes, where we do want to ensure that they have privacy in order to maintain their care, then that is definitely should be acceptable. And there could also be an agreed upon communication method with the teacher who is teaching a virtual class, such as using a chat box for a private message, just letting the teacher know there might be a situation, the student needs to leave for a few minutes and we'll be back after they check their blood sugar. With in-person learning, which is what we've traditionally seen now for many years, there have still been some changes in light of the pandemic this past year. It's important to know that regardless of the changes in the building, students with diabetes still do have the same legal protections. So irregardless of any other rules that have been put in place, whether social distancing or anything else that the school has determined is important to address pandemic concerns, 504 plans, IEP plans are still in force and still need to be adhered to. There could be some modifications. It could mean that a student with diabetes may need to visit the nurse's office solely and independently and not have any other students in there while they're in there. It could mean that the nurse works one-on-one and meets a student with diabetes in another part of the building so that that student doesn't enter into a nurse's office with potentially ill students. So just protecting their health and safety and maintaining their care and privacy is still just as important as it always was. And then when we talk about a pandemic, it's been quite a year with trying to keep up with training staff and with having schools in various states of in-person learning or virtual learning. So many nurses have become very creative throughout the state and throughout the country, including doing our diabetes training for staff online. It's something to consider. Going forward, instead of that small group setting, or if it's not possible to meet and work with training equipment in these large or small groups formats, then virtual meetings for training can be incorporated, and then equipment can perhaps be demonstrated by the nurse or the trainer during the training, or one-on-one after the initial training, where instead of a small group getting together and manipulating training tools, then each person trained can make an appointment and just have a one-on-one session with the trainer to just minimize that that group dynamic that we've been trying to avoid during the pandemic. And also finally, in wrapping some things up, by training staff, they can help in many, many ways. They're able to support our students with diabetes better and able to keep and maintain that safety level of care for all those students so they feel safe when they're at school. Trained staff that recognize signs of low blood sugar are likely to be able to respond quickly in an emergency. Allowing students to be able to care for their care tasks in the classroom and have access to privacy, things like the nurse's office at any time. It's very important. Knowing how to respond again in an emergency, and again, knowing where snacks are stored and where help can be accessed quickly for any particular student at any given point in time. Here's an example of that training toolkit I mentioned earlier. Again, the Missouri Department of Health and Senior Services and their school health section will have a breakdown of a number of diabetes training tools, resources to use, forms to use, and then also how to assemble a training toolkit such as this one with all the contents listed out to get a training program up and running. And here's an example of one way to document training for staff. There are many forms out there, certainly. This was adopted from the Colorado Kids with Diabetes. They have a whole bunch of different forms that can be very useful in putting together a management plan in one's own school. So this was taken from their website and customized for the Parkway School District. And it allows the trainer, the nurse, and the trainee or the trained diabetic personnel to go over each of the topics we've talked about here today. And that gives the person trained an opportunity to ask any more questions and go over things one-on-one individually, have this initialed and documented, and then of course revisited annually. And then some final thoughts as we wrap up here today. School staff, in addition to the school nurses, really need to have some understanding of diabetes management at school, some basic awareness about signs and symptoms in order to prevent any emergency that could arise with a student with diabetes. And promoting a culture of diabetes education, awareness, sensitivity within the school climate helps students with diabetes always feel safe at school. Here are a list of references that were used to pull this program together. I thank you very much for taking the time to view this very important subject here today with me. Thank you.